Welcome to another HACSU vodcast, your Health and Community Services Union. Industrial action is about to be taken tomorrow, in fact, and to tell us all about it, the State Secretary from our Health and Community Services Union, Robbie Moore. Thanks for joining us.
Thanks, Esther. Yeah, it's certainly a disappointing situation that we're in, but it's one that's much needed because these workers have been left with absolutely no other choice.
Now, who is this impacting and what is it and how's it come to this? Because I do know you do try to do everything you can to avoid taking industrial action. So it has to have gotten pretty extreme for this to happen.
Absolutely. Industrial action is always a last resort, but unfortunately for staff working in our health system in medical imaging, they're at crisis point. They have 30% of positions that are vacant. That means they're not delivering the services, and those delays are obviously having a huge impact. These are our radiographers, our sonographers, our nuclear medicine technologists. These people provide vital medical tests that mean that doctors can know exactly where patients are at and work out their next course of treatment. And while we don't have these staff, it is causing bed block and other issues within our health system, and meaning patients are not getting the treatments that they need when they need them.
And just on that too, we've heard from multiple people from all of those areas. And Fiona, for instance, she's a sonographer and has been for many years. And to quote something she was saying, she says, some days it's like going into battle, adding that they have extensively advertised for 6 months to fill a position and not one person has even responded.
Yeah, that's the really unfortunate situation where they've continued to advertise positions. No one's applied because we just don't have competitive salaries. People are taking up work in other states, being paid better in a health system that works a lot better than what our health system does. That's why we so desperately need the market allowance. That will mean that we will pay competitive salaries to our allied health professionals to mean that we can attract the people here, fill the positions, and actually deliver the services that the Tasmanian community deserve.
So the market allowance, what exactly is that? It's a rate. It's just so you can be competitive. It's what they would be paid per hour per.
That's correct. So it's a top-up salary on
Got
your
you.
base salary. For instance, for pharmacists, they've recently received a $10,000 top-up, and that just means that you have competitive salaries with interstate, especially with Melbourne, Sydney, where a lot of people obviously go. And again, we need to see a similar, if not more, or greater allowance for these occupations because they are working short every day because we just cannot fill these vital positions.
Even to be competitive with private hospitals, I'd imagine.
That's right. So a lot of these services are provided by the private sector. And again, those staff are being paid more than the public sector staff. So, we need to have competitive salaries that attract people into these vital positions so that we can deliver these services and so that we can get people moving through our hospital system sooner, which means we can free up beds, we can get people the proper diagnosis and work out exactly what treatment they need.
Lauren Moon is another person that has spoken with us, and she's a nuclear medicine technologist. I can barely say that word, but these are highly skilled people. And she has said she works in cancer imaging. This is so concerning because she said no one wants cancer patients to wait for a scan that they then need to be able to get treatment. So you're talking about cancer patients' treatment being delayed.
Look, I think a test of any society is how you're treating your own people when they're sick. And what we are seeing at the moment is cancer patients being delayed treatment that they need to get urgently for obvious reasons because we don't have the staff to do the diagnostic tests. This is simply unacceptable in a developed country like Australia that we're delaying care, and it does mean that people die sooner and people die who don't need to die. And we've had coronial inquests that have shown this. It's just the government not caring, and that's why these staff are taking this important action tomorrow.
Well, speaking of which, the Department of Health, they acknowledge that there's a problem. Is
Well,
that right? And
well,
they
it's
said
undeniable. Yes, they've accepted that there's a 30% vacancy of these positions.
Yes.
They know there's a problem. They say that it's going through the bureaucracy. It's got to go through State Service Management Office. It's got to go to the Minister, all of these bureaucratic things. When it's a straightforward matter, the argument is there. It's an actual entitlement in their agreement that if you can't attract enough staff because wages are not competitive, you should get paid the market allowance automatically. It's in their agreement. Yet despite all of that, these staff now have to take industrial action, which is the last thing they want to do, but they have to do it because otherwise the Tasmanian community is just going to keep missing out on these vital services.
Well, it sounds like they said that they will do something around that market allowance, but they're not doing anything yet. They're just having meetings and meetings and meetings, or a meeting that could be an email perhaps.
Yeah, exactly. Look, the delays are continued and all we hear is excuse after excuse. You know, we had a health minister saying in the lead up to the election that he was going to fix our health system. This is something easy he can do. Just tick off on paying competitive salaries, the same salaries that other governments are paying their staff interstate, and he's not doing it for whatever reason. And it's totally unacceptable because it is costing Tasmanians lives.
You know, we all are going to need to use these services, so we should all be outraged.
Absolutely. Well, tomorrow, starting at the Royal Hobart Hospital first at 10 a.m, staff are stopping work for half an hour. So come down to the Liverpool Street entrance of the Royal Hobart Hospital at 10 a.m. and support these workers if you can make it. And then if you can help lobby the minister, write to your local politicians in your electorate and let them know how important it is that we have these vital health professionals here in Tasmania so that Tasmanians are getting the treatment and the diagnostic tests done that they need to ensure that they're getting the treatment they deserve.
And just looking at some of the, like in Liverpool Street, there's days when there's been no services, like everything's had to be cancelled. You've got reduced services at the Royal Hobart Hospital, operating theatre services reduced. Like this medical imaging, in my ignorance, I didn't understand exactly how much we need all of these services.
Look, medical imaging is the hub of the hospital. A lot of people think of the emergency department, but what interacts between all the wards, et cetera, is medical imaging, getting the tests done, knowing where patients are at. They provide this vital service and it is affecting every other service because this system is failing. We've even got the ironic situation where the government have spent $8 million on a new CT scanner and there's not going to be any staff to provide for it. So, you know, when the government talks about wasting money, we've got a new piece of equipment, a great piece of equipment, but we're not going to be able to use it because they don't have the staff. And there is an easy solution for getting those staff, and that is obviously paying the market allowance so that we can attract and retain our medical imaging staff.